Hello and namaste to all of you. This is Name-Shalu Singh from Department of Physiotherapy and Diagnostics from Jayoti Vidyapeeth Women's University. So today I'll be discussing with you about the quantitative estimation of albumin in your urine or albumin urine test. Now, an albumin test checks for a protein called albumin. So albumin is normally found in blood and filtered by the kidneys, and when the kidneys are working as they should, they may be very small amount of albumin in the urine, but when the kidneys are damaged, abnormal amount of albumin leaks into urine, and this is called albuminuria. And if the amount of albumin is very small but still abnormal, it is called microalbuminuria. And now microalbuminuria is most often caused by kidney damage from diabetes, but many other conditions can lead to kidney damage, and these include high blood pressure, heart failure, cirrhosis, and lupus. So, if early kidney damage is not treated, larger amounts of albumin may leak into urine, and when kidneys spill albumin, it can mean serious kidney damage is present, and this can lead to chronic kidney disease. Now, an albumin urine test can be done on a sample of urine that is collected. Number one, which can be collected at a random time. So, it is usually after the first time you urinate in the morning. Secondly, after an over a 24-hour period. And thirdly, over a specific period of time, such as 4 hours or overnight. So, now why is this test done? So, the reason why this test is done is to check for albumin in urine, and finding it early may change the treatment. So, a person will keep as much kidney function as possible, and sometimes an albumin creatinine ratio test is also done. So this urine test compares the amount of albumin with the amount of waste products called creatinine. So the test can help give a more accurate measurement of albumin levels. So this is because the amount of albumin can change depending on how much water is in your urine, but creatinine levels they tend to stay same. Now, nextly, how to prepare your patient for this test. So basically, you don't need to do anything special to prepare for this test. And the reason why it is done is because it is done to check for albumin in the urine. So finding it early, so it may change so as to keep person will keep as much kidney as possible. So the now the reason how it is done, or the how is it done is for a random urine test you will provide. So now for random urine test, you'll provide a clean catch midstream urine sample, and a morning urine sample gives the best information about albumin levels. So the clean catch midstream one-time urine collection. So for that you have to wash your hands to make sure that they are clean before you collect the urine. And if the collection cup has a lid, remove it carefully, let it set it down with the inner surface up, and do not touch the inside of the cup with your fingers, and clean the area around your genitals. So for men, pull back the foreskin if you have one, and clean the head of the penis thoroughly with the medicated toe letters or swabs. And for women, spread open the folds of skin through the vagina with one hand, and then use your other hand to clean the area around the vagina and urethra thoroughly with medicated tottles and swabs, and wipe the area from back to front to avoid spreading bacteria from anus to urethra. And now you can start urinating into the toilet or urinal, and women should keep holding apart the fold of skin around the vagina until they urinate. And after the urine has flowed for several seconds, place the cup into the stream and collect about 60 ml of this midstream urine without stopping the flow, and do not touch the rim of the cup to your genitalia area, and do not get toilet paper, pubic hair, stool, feces, menstrual blood, or any foreign matter into the urine sample. And once you finish urinating into the toilet or urinal, carefully replace the lid on the cup and return the cup to the lab. And if you're collecting urine at home and can't get to the lab, uh, keep it into a refrigerator. If you can't get to the lab in an hour, refrigerate it. And now a urine sample collected over time, such as over 4 to 24 hours, gives more accurate results. So you may be asked to collect your urine over a specific time period. Now, what is timed urine collection or 24-hour urine collection? So, you start collecting your urine in morning, and you will when first get up and empty your bladder, but do not have to save this urine. So, write down the time that you urinated. This marks the beginning of your 24-hour collection period. For the next 24 hours, collect all your urine, and your doctor or lab will usually provide you with a large container that holds about 4 liter or 1 gallon, and the container has amount of preservative in it. So urinate into a small and clean container and then pour the urine into the large container. Do not touch the inside of the either container with your finger, and keep the large container in the refrigerator for 24 hours. Now empty your bladder for the final time at or just before the end of 24-hour period, and add this urine to the large container and record the time. And do not get the toilet paper, pubic hair, stool, feces, menstrual blood, or any other foreign matter in the urine sample. Now, this test does not cause any pain, so there is no risk and no fear in getting this test done. So, but what are the risks that are included in this test? So, since there is just the urine sample that is collected, so collecting the urine sample will not cause any problems, or there is no risk or no side effects for getting this test done. Now, what are the results for this is an albumin test checks urine for the presence of a protein called albumin. So this is called albuminuria. So mostly it often caused by kidney damage from diabetes, but many other conditions can lead to kidney damage. And this the number are just the guide, and the range for the normal varies from lab to lab, and your lab may have different range, and your lab report should show that what range your lab uses for normal. Also, your doctor will evaluate your results based on your health and other factors. So a number that is outside the normal range here may still be normal for you. And now albumin in urine and the normal reason. So on one-time collection or spot urine collection, less than 2 milligrams per liter of is to be found. For 24-hour collection in adults at rest, less than 80 milligrams in 24 hours, or 0.002 to 0.08 grams per day is can be estimated. And for adults moving around, less than 150 mg in 24 hours or less than 0.15 grams per day is estimated in urine. And for 10-hour overnight collection, less than 20 milligrams per liter or for 10-hour or overnight collection can be estimated. Now, what are the higher than normal values? So you may need more than one test to find out how well your kidneys are working. So if your results are higher than normal, your doctor may check you for your more than often to watch for kidney damage. So if you have 2 or 3 high results in a 3 to 6 month period, you have diabetes, and your doctor may find kidney damages or that is diabetic nephropathy. And even though diabetes is the most common reason to find for high results, there are many other kidney problems that cause high results. So pregnant women with diabetes may have their urine checked to watch for high amount of albumin. Now, what affects the test basically? So you may not be able to have the test or results may be found helpful if you have a urinary tract infection, high blood pressure, heart failure, or high fever during an infection, and if you exercise just before the test, or if you take a medicine such as aspirin, corticosteroids, and some antibiotics such as amoxicillin, Or if you have menstrual bleeding or vaginal discharge, then they may temporarily affect your urine samples. Now, three tests are used to check for kidney damage, and these tests are a blood pressure, urine albumin, and a creatinine blood test for to calculate estimated GFR, that is a glomerular filtration rate. And creatinine is a waste product that is filtered out of the blood by healthy kidney. So if you have a type 2 diabetes, you have to test these. You have these tests when you are first diagnosed, and then have them each year to check for diabetic nephropathy. And if you have type 1 diabetes, you should have these tests to check for diabetic nephropathy each year, starting 5 years after diagnosis. And if you have either type of diabetes and are pregnant, talk to your doctor about how often you need to be tested. And the urine dipstick test can be used to check for albumin in a single sample of urine, but the dipstick test is not accurate test for finding albuminuria in urine test, so it is not recommended in a place an albumin urine test. Now, this was all about your albumin test in the urine or albumin urine test. Now, about further albumin creatinine ratio in urine, I'll be telling you in the next lecture. Uh, now, in your next lecture, I'll be telling you about your albumin creatinine ratio. Now, until then, if you have any doubts, you can contact me. And this is it. Thank you and take care.